Okay, so when it comes to treating the cerebellum and brain dysfunction, your cerebellum and brain require two things in order to function properly. The survivability of your brain depends on fuel, and its basic components is glucose and oxygen, and activation. So we need to stimulate your brain, but once we have done our health history and evaluation, we want to determine what side is the weak side and do adjustments and therapies that will strengthen the weak side and leave the strong side alone. So one of the therapies we use is vibration. Vibration is very useful. We use it on one side of the body. Vibration fires into the dorsal columns on the spinal cord, which fires directly up into the cerebellum, and does it on one side. Fires up the cerebellum, which then fires to the opposite cortex or front part of the brain, completing that circuit to make those areas stronger. Now, vibration is vibration. I use the vibrocussor, but you can use other types of massage techniques, vibration plates. Anything that vibrates really works well, just that you have to make sure you're only doing it to one side of the body. Now we also use gentle chiropractic adjustments on one side of the body using the arthrostim and the activator. When we're doing the adjustments, literally what we're doing is we're changing muscle tone. It's not how hard you make adjustments, it's how fast you do it. And the faster you can make an adjustment and the more success and the more times you can do it in a row, the more activation, the more stimulus we can get into the brain. And as we're doing it on one side, it's very specific to help out the weak side. I also use what's called an upper body ergometer. It's a fancy name for bike pedals that you can pedal with your hands and arms. So we add to this by having the person wear an oxygen concentrator with using a nasal cannula to increase the amount of oxygen that the person is breathing as they're doing the exercise. The upper body ergometer is specific towards working more of the outer cerebellum areas and the cortex, but as you're doing the exercise, because of the increased oxygen, as you're exercising, you're getting more blood to flow to your brain. The more blood that flows to your brain that has more oxygen, the more fuel we get into the brain to help it become healthier. We will use auditory stimulation in one ear. As we stimulate it in one ear, it crosses over to the opposite ear. We may change the type of music or the rate or rhythm of the music to try and be even more specific to which side we're trying to stimulate. We'll use auricular stimulation on one ear using electroacupuncture. Again, by stimulating one side of the body, we can fire to the opposite side brain and help get that side healthier by exercising just the one side. We'll use warm caloric in one ear. The caloric activates an area of the brain called the vestibular system, which fires into the cerebellum. As it fires into the cerebellum, it also fires into some ocular eye muscles, and so once again we're firing particularly one side of the brain, particularly by getting the cerebellum to fire on the same side as the warm caloric. We'll also use olfactory stimulation in one nostril. So we'll have a person plug their nose on one side and have them breathe something in through the other side. We use spices, we'll use different things that, as far as foods go, onions, garlic, those types of things, they tend to have more of an impact because there's also a limbic connection when you're using food, which then fires up the brain even more. We will use visual stimulation in one eye or both. Well, you can use eye exercises where we'll have the person move their eyes in certain directions, or we'll use the letter up in the on the left hand side. You'll see that's the letter A, but what you probably don't see is that the letter A is made up of little letter U's. The little letter U's are more of a left brain activity because you're looking at the little details, whereas looking at the big picture, the big A is a right brain activity. The boy on the right, I don't know who that is, and that's the point. If you look at people's faces that you don't recognize or don't know, that is your right brain activity. So you can have magazines that you can page through that if you don't recognize that person, that's going to be more of a right brain stimulation. So I hope that gives you an idea of some of the different things that we can do to work on a person's brain imbalances to help bring the weak side to become more active and make it stronger so that it becomes equally activated as the strong side. And once that brain starts talking one side to the other, you see a lot of cool things happen because those connections kick in and the brain works as a whole and not half of what it could be. So consider whether that you may be neurologically imbalanced. For those of you who know where I'm located, you can sign up for free 15-minute consultations and neuro screenings for yourself or for family to come on in, and please tell other people about the brain-based therapies. There are lots of people that can be helped using brain-based therapies, not having to use drugs and surgery, and be able to gain help and potentially be cured of whatever might be ailing them.